Thank you. Hi, and welcome back. We are going to be doing bones and skeletal tissues today. Once again, as I'm going through the notes, please make any notes about anything you don't understand. You could either email me or talk to me in lab or during my office hours. I'd be happy to get back to you. So we're going to be talking about bones and skeletal tissues. Next lecture is going to be the actual bone structure itself. Today's lecture, we're going to be looking at the microscopic structure of the bones, how they develop in the uterus, embryologically speaking, and then progress to the mature skeleton that we have as adults. Skeletal cartilages. We actually begin in utero. Our skeletal system begins as a cartilage, as a cartilaginous structure or fibrous tissue. That cartilage and that fibrous tissue will start to ossify. That means that calcium phosphate and hydroxyapatite will start to deposit down onto that cartilage structure and start to harden the bones from cartilage into the bony structure that we're familiar with. If we look at this slide, I'm going to zoom in on that slide because I know the type is small. We're talking about structure, types, and location. Okay, so calcification, I just explained to you, is when cartilage and those fibrous membranes that are in the embryo start to harden into bone tissue. That happens through a substance called calcium phosphate. And that calcium is a calcium that we know that deposits into bone. There are other salts as well, but that's the major one that are going to harden those bones. And also the other one, the major one, is hydroxyapatite. Skeletal cartilage is the developing skeleton. We have 3 different cartilages in the body. The developing skeleton that we know will turn into all the bones of the body begins as hyaline cartilage, that next cartilage just below that. The other 2 cartilages below hyaline cartilage, we have elastic cartilage and fibrocartilage. These are 2 cartilages that we'll find in the body in very specific areas. Elastic cartilage is found in the external ear and the epiglottis, that little flapadoodle that goes over the trachea or the windpipe. Okay? The great way to remember that is you can see they all begin with the letter E. Elastic cartilage, external ear, and epiglottis. E. All those are elastic cartilages. Fibrocartilages turn out to be discs of the spine and the knee. There's also discs in the jaw and the elbow. All of those disc-like cartilaginous structures are fibrocartilage. Okay, so those are the 3 different types of cartilage that we have in the body. Hyaline cartilage is going to be the one that actually turns into our skeleton, so that's a good one to remember. Okay, classification of bones, how the bones are actually classified. Let's take a look at this. Overview. There are 206 bones in the body. The body is divided into 2 major parts of the skeleton. Axial, which is just like the axis that we would see that the earth would spin on, and appendicular. Appendicular sounds like appendages. So our arms, our shoulder girdle, our legs, and our pelvic girdle are going to be the appendicular skeleton. So that's the major 2 subdivisions of the skeleton. They're also classified by shape. I'm going to zoom in on this PowerPoint once again. Okay? Long bones, you could see in the upper left-hand corner, are long. They have a shaft and usually 2 rounded ends. Short bones are going to be, you got it, short. We'll find those in the wrist. There are short bones in the wrist. They tend to be square. Okay? Flat bones are thin and flat. You can see in the upper right-hand corner the picture of the sternum. That's a great example of a flat bone. The sternum is the centerpiece of the chest plate to which all the ribs are connected. Irregular bones, a vertebra is a very good example of irregular bones, and they are obviously irregularly shaped. They aren't square, they aren't really round. They're an accumulation of many different shapes put together in kind of an odd, irregular shape. Functions of bones, 5 must-haves. In addition to our shapely figures, bones help to support our body, protect our body too. If you think of the strong thoracic cage, it provides really great protection for the abdominal and also the thoracic organs, the heart and the lungs. Okay, so these organs are encased in a very strong bony encasement, also cartilaginous, if you think about the cartilages between the ribs and the sternum, okay, that help to protect our chest plate. Movement's pretty obvious, right? Bones provide the leverage to which muscles can move them to move us through space. Mineral storage, this is a great concept. This is really one that's not as much common sense that I'd like to talk to you about. Our bones are a storage house for calcium. If you think back to previous lectures, calcium helps nerves and muscles to fire and work. So we need calcium in the bloodstream to go out to muscles and to nerves to make them work, as well as using calcium in the bones to harden them. So it ends up being a balance between the blood and the bones with our calcium storage. If we don't have enough calcium in the blood, we'll tap into that reservoir of the bones to get calcium out. This is why it's so important to take a calcium supplement, especially a calcium supplement with vitamin D. Vitamin D helps the body to absorb calcium from our foodstuffs. Calcium in the adequate levels in the body will help to strengthen the bones, but will also help muscles and nerves to work and fire. Blood cell formation, hematopoiesis. In the bone marrow, in the bones, I will show you specifically where we create blood cells, both red and white. So the bones are a very good storage house for that creation of red blood cells and white blood cells. Bone structures. Bones are organs. I want you to think about this for a minute. Think back to the beginning of ANP1. Bones are organs because by definition, organs have two or more tissues that function together, right? So bone is not just a piece of dry bone. Bone is cartilage that's been hardened. It has bone marrow in the center that creates blood cells. It has a nerve layer on the outside, and it also has cartilage inside and on the ends of bones, which I'll show you in a little bit. Okay, so bones are actually organs because it's comprised of two or more tissues that function together. Bone markings. So now I want you to think about the actual structure of bones. We may have seen some examples of bones in labs. We may not yet, but we will in lab. And if you look at the surface of bone, they're not perfectly smooth. Okay? There are some areas on bones that stick up. There are some areas that either form a hole or an indentation. Okay? For the most part, the areas that stick up on the bones are going to be the sites of attachment of muscles. What muscles do is they pull on bone over and over again, and they help to raise that area of the bone up because the body will actually deposit more bone in that area because it feels that stressor. Okay? So raised areas tend to be the site of attachment for muscles. Indentations and holes tend to be openings for either the passage of tendons, the passage of nerves, the passage of arteries and veins. Okay, so if we have an opening, quite often one of those structures will pass through or over that opening. Okay, so bone markings, external projections or depressions. The bone texture itself, if we were to take our humerus, which is the upper arm bone, cut it in half and look inside, okay, inside of this long bone that has a shaft and two ends. On the outside of that bone, you're going to have what's called compact bone. We've actually looked at compact bone last semester. Compact bone microscopically looks like the rings of a tree, okay? But don't forget, it's not just circles. That is the end of a tube, okay? So compact bone is made up of several tubes put together, okay? When we look at the microscopically, I'm going to show you this in a little bit. So if this isn't making sense, it will in just a little bit. If we cut them on end and we look in the end of that tube, it looks like the rings of a tree microscopically, okay? But compact bone is basically long tubes pushed together in a compact way to make what looks like solid bone, okay? You could see that on your PowerPoint. You could see that on the overhead here. So the outside of that looks like nice, solid, compact bone. Spongy bone, which you could see on the inside, looks exactly like sponge, okay? Spongy bone is going to provide area to lighten the bone, okay, that's between those two nice solid layers of compact bone. So if we had all solid compact bone, that would be a really heavy bone. But we have nice solid bone on the outside, and we have that trabecular or that spongy bone on the inside, which lightens the bone. But this is also where bone marrow will be located, in this spongy bone. Okay. Structures typical of long bones. So once again, with long bones, we have a nice long bone, okay? The epiphysis is on the ends, epiphysis ends. So epiphysis would be the actual anatomical name for the ends of these long bones. The shaft is the diaphysis, okay? Diaphysis is the shaft. So if we look at the epiphysis, we can see, and if you can't see this on this PowerPoint, here, let me zoom in, okay? So I'm gonna zoom in. This is gonna be the epiphysis, and I want you to see this nice spongy bone here, and then I want you to see when I zoom in that this is pretty open here. Let me take a look at that a little bit closer, okay? So you can see the ends or the epiphysis that's filled with spongy bone. You can see the center that's open that just has a compact bone on the outside, okay, in the diaphysis. In the diaphysis, we have what's called yellow marrow. It's kind of a fatty substance that we find in the diaphysis of a bone. On the ends, or the epiphysis, we have that spongy bone, and that's where we find red bone marrow. Excuse me. Red bone marrow is going to be the area that we create red and white blood cells in the epiphysis of these long bones. There's real specific areas we'll get into in a little bit, but just to give you an idea of what that looks like, that spongy bone is going to be filled with red bone marrow, okay? Now, the other thing that I want to point out at this point, I'm going to zoom back out, okay? On the ends, covering the ends of these long bones, you're going to have what's called articular cartilage. We're going to get into this in the notes in a little bit, okay? Do you ever chew on a chicken wing? It's going to gross some people out, sorry. Chew on a chicken wing and you get that real almost rubbery substance. That's articular cartilage. What articular cartilage does is it caps the ends of long bones, and it helps to provide a cartilaginous protective layer over the ends of long bones. So that way, when we put pressure on them, there's a little bit of sponginess there. Okay, so while we're at this picture, I wanted to point out the articular cartilage. Short bones. Short bones are going to have compact bone on the outside with spongy bone on the inside. So any of these bones that we look at are all going to have compact bone on the outside to give them a nice strength, and spongy bone on the inside to lighten the bones a little bit, and also an area where we can get that red bone marrow, so we can make red and white blood cells, okay? So red marrow is found in the sternum, which is going to be the breastplate, okay? In the body of the vertebra is what that is referencing. The ribs, the hip bone, and the scapula, which are going to be the wing bones in the back. Those are going to be some of the main reservoirs that we'll have for red bone marrow that will provide red blood cells and white blood cells. Yellow marrow is more of a fatty substance that we'll find in the diaphysis or the shaft of bones. Okay, microscopic anatomy of bone, okay? So compact bone, we went over this last semester. The way that it's structured, I would like to draw on the board for you. So let me zoom in on the smart board, okay? And this is all in the notes that we're going over right now. You can see in your notes that long tubular structure of what's called an osteon. An osteon is the microscopic structure that forms compact bone. They look like long tubes. There are several of them compressed together to form that compact bone. So if you can imagine that I take that long tube that's forming the compact bone and I cut it transversely, then I turn it on end so you're looking into it like you'd be looking into a tube. Okay, these are the structures, or the circular structures that look like a tree trunk. And one of those circular structures is called an osteon, and that's what I'm going to show you right now. So here would be the center part, and here would be the rings that would be shaped like the rings in a tree trunk. The osteon starts depositing bone in the center, okay, here, and then deposits layers moving out, making that bone thicker. Okay. Running through the center is a structure called the Haversian. Let me see if that's big enough. Let me write that a little bit bigger for you. Haversian canal. The Haversian canal has a nerve, an artery, and a vein. Once again, it's called a neurovascular bundle because it has a nerve, an artery, and a vein. That'll run through the center of this Haversian canal, runs up the full length of the tube, and then it sends offshoots going into those rings of the tree trunk, per se, of the osteon. Okay? These circles are called lamellae. Okay, the circles are called lamellae. Now, if you remember back to the different cells that we talked about last semester, we have a mature bone cell that we'll see microscopically that's called an osteocyte. Osteocytes are going to live right in those lamellae. Okay, osteocyte. Now, finally, in order to get nerves and blood vessels out to those osteocytes, we have little structures called canaliculi. I know, it's a crazy word, right? Canaliculi. So it starts in the center, and canaliculi are just like little canals that'll run out from the center out to the osteocytes. So that way you can get nerves and blood vessels out to the tissues of that osteon, okay? And then, of course, in compact bone, we have several of these osteons grouped together. I'm just giving you one example. And this works really well with the picture that's on your PowerPoint because it shows it as a long tube, and I'm showing you as if we were cutting through it transversely, okay? Okay. Another look at compact bone. So this shows you how, and we'll zoom on that so you can see a little bit better. A bunch of those osteons grouped together to form that nice solid looking compact bone, okay? And then you have bigger circular layers that are around the outside. On the bottom right there, you can see an actual microscopic picture of an osteon. We've looked at that in lab. Everybody loves looking at that in lab because it's so easy to see and recognize. Okay, so spongy bone does not have that regular osteon appearance or structure. Okay, has lamellae, osteocytes, canaliculi, much more haphazard and all over the place. Okay, just as you would imagine that spongy appearance would be. Chemical composition. So there's an organic and an inorganic portion. The organic portion is going to be that cartilaginous precursor called, actually called osteoid. Okay, so it has a very similar composition as cartilage. It hasn't been hardened yet. Okay, once we start to bring in the inorganic portion, which is going to be your hydroxyapatites and your calcium phosphate, those are salts, those are mineral salts, which are going to help to strengthen the structure of that osteoid and make it stronger. So if we didn't have those salts, the calcium phosphate and the hydroxyapatite, we would have what? We would have bones that are very soft. And if we have soft bones, they could eventually bend and break. Okay, that's a condition called osteomalacia. We'll get to that in a little bit. Bone development. Ossification or osteo, which is bone. Genesis means the creation of. Okay, the creation of bone is the formation of bone. Okay, I find this amazing. By week 8, the embryo begins to form bone. Okay, so you have that hyaline cartilage precursor. We also have fibrous membranes. I'll tell you the difference in just a minute. By week 8, that's starting to calcify and harden. There actually is there a picture in your notes in a little bit. I'll show you. Okay, so because we have cartilage and because we have membranes, we have two different processes to harden or create the bone in those areas. There is something called intramembranous ossification. So there are two main areas that actually start as fibrous membranes in the body, which then deposit those mineral salts and harden. It's the cranium or the skull bones and the clavicles. Okay, those start as fibrous membranes. They deposit, your body deposits mineral salts into them, and they harden and turn into those hard bones. Okay. Endochondral ossification is when we actually take hyaline cartilage, and chondro references or is the prefix for cartilage. So endochondral ossification is the hardening of hyaline cartilage to bone. Okay, so if it starts as a fibrous membrane, which is only going to be in the cranium and the clavicle, it's intramembranous ossification. If it's the rest of the body, we're converting hyaline cartilage into bone. That is endochondral ossification. Okay, so two different processes will cause that hardening of the bone. Okay, so talking about the hardening of the hyaline cartilage into bone is a very specific series of events. Okay, I want to talk to you about how long bones will ossify or undergo osteogenesis. Okay, so we have a picture here on our PowerPoint that I'm going to zoom into. I'm going to talk to you about it from this side of the screen to the fully developed side of the screen as I talk your way through it. Okay, so I'm going to zoom in on that. You can see the most immature form is on the far left. That's almost completely hyaline cartilage. You can see that on the outside we get this formation, what's called a bony collar. And that bony collar is the outside portion of the bone. And we also get what's called a primary ossification center. That is going to start in the middle of that diaphysis or the shaft of the bone, and it's going to move from the middle towards the ends. Okay, it's going to move from the middle towards the ends. It's going to keep replacing that hyaline cartilage until you get almost completely, totally filled with bone in that center portion. And then you could see about the third bone over, actually under number 4 or above number 4, you can see what's called the secondary ossification centers. Those secondary ossification centers are going to form in the epiphysis or the ends of those long bones. It starts in the center of the epiphysis and it starts to move out until eventually you could see on the far right that both the primary and the secondary keep moving towards each other until you have that bone completely replaced, or I'm sorry, that cartilage completely replaced with bone. Okay? Now what I do want to point out to you really quickly is as you're looking at that ossification on the far left, you can see right here, okay, you have a thin plate of cartilage left. So right between the diaphysis and the epiphysis, we have a thin plate of cartilage. You also, on both ends, you have a thin plate of cartilage here. And I want to talk to you about that. That is called the epiphyseal growth plate. The epiphyseal growth plate. Those are simply your growth plates. We've talked or heard in the past about our growth plates closing. Okay, for females it's around 18, for males it's around 21. Those growth plates stay open, and if you can imagine you deposit bone at that growth plate, it'll keep your long bones growing longer. So you keep increasing in height. Once you get to 18 or 21, somewhere in that range, they close. So that way you stop growing. Okay, so that stays hyaline cartilage. The epiphyseal growth plate is hyaline cartilage. It gives us the chance to keep depositing more bone and lengthening our bones in our body. Now, looking at the ends here and here, we also have hyaline cartilage left over. That is called articular cartilage. It's that articular cartilage I talked to you about before, where the ends of long bones come together. It provides some cushioning, so when they bump together, they don't hurt the ends of those bones. Okay? All right. So endochondral ossification, you have a primary growth center in the diaphysis. You have two secondary growth centers at the epiphysis. They grow towards each other, eventually ossifying the whole bone, except for the growth plates until we get to between 18 and 21. And except on the ends where we have articular cartilage, where we will always have articular cartilage unless we wear it away. Okay? We wear this away. You'll hear some people say, oh, my knee, I've damaged it so much, it's bone on bone. It's because they lose all that articular cartilage, and they damage other components of the knee as well. But it's wearing away of that articular cartilage. Okay, postnatal bone growth. Our bones will continue to get thicker ever so slowly as we get older. Okay, they won't lengthen anymore once those growth plates close, but they will get wider. Okay, how that happens is from two little cells called osteoblasts and osteoclasts. Okay, I'm going to zoom in on the screen here. Okay, so if you can imagine bone, once again, I'm going to use a long bone as an example. Okay. I know it's not very good. Bear with me. I'm not the best artist. Those long bones have a hollow center. Okay. So what happens, this is how our bones get thicker, is we have two cells. We have an osteoblast, which is our baby cell that we've talked about last semester, baby bone cell, okay? And we have a new cell we haven't talked about yet, osteoclast, okay? What osteoblasts do is deposit new bone. So if we need to regenerate or make more bone tissue, osteoblast is our man, okay? It's gonna create new bone tissue. Osteoclast breaks it down. Our bones need to be able to reform themselves, but we also need osteoclasts to break down bone tissue so we can release calcium back into the blood. Because once again, we need calcium to make muscles and nerves fire. Okay? So osteoclasts break down bone tissue. Okay, so I want you to think for just a minute. If osteoclasts are more active on the inside of these shafts of the bone, they're eating them away, okay? Osteoclasts are eating away the inside of the bone, and osteoblasts, I'll draw it right here, are depositing more bone on the outside. The bones will continue to get ever so slightly thicker as we get older, okay? So bones will get a little bit thicker as we get older because osteoclasts eat away on the hollow inside of bones. Osteoblasts will deposit bone on the outside, okay? And that's called appositional growth. That's right in your notes. Excuse me. Hormonal regulation. So growth hormone in childhood, once our hormones kick in and we start to undergo puberty, okay, we will have changes due to testosterone and estrogen, which will thicken the bones, okay? If you ever notice women, as they hit puberty, they start to get wider hips, okay? It's because estrogen starts to kick into play and it helps to thicken the bones. Same thing with testosterone. As boys get older and turn into young men, their bones will get thicker as well. But we also have a substance that's called growth hormone that's released, which will help make muscles and bones bigger. Okay, that's primarily released in childhood. It can be taken supplementally when we get older, although there are some negative effects to that. Okay, so hormonal regulation, those are a couple of the hormones that will help our muscles and our bones to grow. Okay, remodeling and repair of bones. Okay, it occurs at the periosteum and the endosteum, and I actually just went over those structures, believe it or not. I just didn't give you the words for them. So let's go back to our smartboard here. Okay, think about what those words mean. Endosteum, endo means endoscopy is looking inside, Okay, so endo is going to be on the inside of the bone. Okay, so when we're talking about this surface inside the bone, that's called the endosteum. The surface around the perimeter of the bone is the periosteum. Okay, so periosteum is around the perimeter on the outside, endosteum is on the inside. Okay, so our bones can remodel. We can break down that inside, which we just went over, and we can deposit bone on the outside. What's interesting though is our body will deposit more bone in areas of stress. Okay? We've probably heard of bone spurs. And if you take a picture of a bone spur, it actually looks like a little piece of bone that's stuck on, or an excess piece of bone stuck onto your regularly shaped bones. What that is a bone spur or an an osteophyte. And what that is that's a response to stress in that area. That osteophyte or that bone spur is part of what is called arthritis, okay? Osteoarthritis. Our body knows that something's not quite right structurally in that area, and it's actually trying to support it with extra bone. That extra bone, though, is abnormal. It can push on the tendons surrounding that area, the cartilage around that area, and it can cause inflammation, which gives us that pain with osteoarthritis. Okay. If you look at your notes, 99% of calcium is in bone, which is fascinating because we only need 1% of our calcium reserves to make muscles and nerves fire, which we're constantly doing. I'm a million times I'm releasing calcium to make my muscles and nerves fire as I'm talking to you. Okay. Hormonal mechanisms of calcium. Okay. So, whoops, I'm going to zoom back out to both screens. So, hormonal mechanisms of calcium. We actually have what's called our thyroid. Our thyroid we're going to go over when we go through endocrine. Our thyroid is in our neck, okay? Behind our thyroid are little what are called parathyroid glands. These two glands help to regulate calcium absorption and calcium removal from the bones, okay? Parathyroid glands, which are on the back of the thyroid once again, okay, is released when there's too little calcium in the blood. And if we have too little calcium in the blood, we cannot use that calcium to make muscles and nerves fire. Okay, so parathyroid hormone will be released. It'll release calcium from the bones by using those osteoclasts to eat away at the bones and release calcium. And then we have enough calcium to circulate through our system, okay, to make our muscles and nerves fire. Calcitonin, I'm embarrassed to put this on tape. Calcitonin puts it in the bone, okay? Calcitonin, which is actually released from the thyroid, and I'll show you specifically where when we go over that gland, okay? Helps to put calcium into the bone, and it helps to strengthen our bones, okay? Response to mechanical stress. When I talked to you before about abnormal stresses causing an extra deposit of bone, that is called Wolff's Law. There's an actual electrical charge that will be put across bone if we either compress it or we stretch it too much, and we'll deposit more bone in that area. That's a normal response to stress, but occasionally we'll have abnormal excess stresses in an area, which will cause that extra deposition of bone, causing a bone spur. Okay. Bone repair. There are several different types of fractures. I'd like to just talk to you about a couple. So I'm going to zoom in on the screen because I can see that it looks pretty small from here. Okay, so different types of fractures. Non-displaced versus displaced. That's whether the ends are approximated or not approximated. This is going to be important because this could either mean that you just put a cast on or that the patient may have to have that bone set or put back into place, okay? Complete versus incomplete is referencing whether it's partially through the bone or completely through the bone. Linear or transverse. Linear would be along the length of a long bone. Transverse would be along the width of a long bone. Open versus closed. This is whether a bone has poked through the skin or it stayed under the skin. Okay. Healing usually takes about 6 to 8 weeks for bones. The way that the healing stages go is you have what's called, and this is on the picture on the PowerPoint slide to the right, what's called that first picture. Number 1 is hematoma formation. Hematoma formation is when we start to have blood vessels form a clot. That clot surrounds that area and it forms an area for fibers to start depositing in, but it also forms an area that fights off any potential infection. If we have a lot of blood there, we also have white blood cells to fight off potential infection. That blood clot or hematoma eventually turns into cartilaginous callus. So we have fibrous tissue start to fill that hematoma. Then we have cartilage start to replace that blood clot. When we start to get the hyaline cartilage in that area, that soft osteoid precursor to bone, getting ready to accept those mineral salts, which forms what's called a bony callus. Okay, new bone will form in that area. It may not look perfect at first, but what will eventually happen as the bone starts to reform is you get bony remodeling. The bone will eventually shape to look identical, if not very, very close to the original size and shape. Okay, so those are the 4 steps: hematoma, fibrocartilaginous, bony callus, and bony remodeling. Okay, I'm going to keep zoomed in so we can see these. These are right in your book. If you'd like to pause the tape and go look for them, if it would be easier to see, I'd like to go through some of these fractures, kind of interesting bread and butter stuff. The first one you can see is what's called comminuted. This is when you have multiple bone fractures. This is really tough fracture because if they are displaced and you have multiple pieces, you will have to have surgery, okay, to back into place. Compression fracture. You can see the next one to the right. Compression fracture is going to be predominantly in the spine. This happens when we have a condition called osteoporosis, or thinning of the bones. And what happens is the vertebra actually compress down. Okay, you can have this happen acutely. I had this happen to a patient in my office. She was elderly. She had osteoporosis. She simply was opening a window and heard a pop and had severe pain in her spine. And it ended up being a compression fracture in her vertebra. So that's going to be the predominant area that we're going to see the compression fractures. Spiral fractures on the left. Spiral fracture happens quite often, especially with athletes, when they plant their foot on the turf and they pivot. And that pivoting will actually cause a twisting of the bone, and you get that spiral presentation in that fracture. Epiphyseal. Epiphyseal fracture is really dangerous because what happens is it breaks right through the growth plate. And if this happens in young adults or young children and that growth plate is not completely closed yet, you can actually damage that growth plate and you would have that bone end up being shorter than the other if it's not properly fixed. Okay, this is definitely a surgical consult that needs to be fixed. Depression fracture is pretty easy. Boy, that, that's a ball peen hammer right there, probably. I don't know if somebody got mad at somebody else. That would take excessive, very small force. If you don't know what a ball peen hammer is, just imagine a hammer. Okay, it's just a really hard force in a very specific area to cause that depression fracture. Green stick. We would see green stick, especially in young children. Okay, green stick tends to happen when we don't have fully ossified or hardened bones yet. Okay, breaks in completely just like you would with a green stick or a green twig. If you've ever tried to break a stick that's still soft, it's really hard to break. You get a little bit of break on one side because you have that kind of bending presentation or injury, I should say. Okay. Homeostatic imbalances of the bones, okay, more than just fractures. So osteomalacia and rickets, this is a sad little disease. You can see from this picture. I'm going to keep it once again on the PowerPoint so you can see these pictures well. Osteomalacia is when you don't have enough calcium or vitamin D. Now remember once again that we need vitamin D. Vitamin D is so important because vitamin D is what helps to absorb calcium from the intestines. We're also finding such a strong link with magnesium. Magnesium is very important to take calcium and deposit it into the bones. Okay, so osteomalacia and rickets is both conditions where we don't have enough calcium or vitamin D. Okay. Rickets is seen in young children. Quite often they get this bow-legged presentation because their bones are not hard, they're soft, and the weight of their body will actually cause them to be deformed and shaped in a bow-legged. Okay. Osteomalacia is seen in adults. It's when the bones are not adequately mineralized. They tend to be softer, and they can also get a little bit of bending, but more often they'll present with a fracture. And I believe the next screen is a picture. There we go. You could see right where the red arrow is pointing. You could see there's a fracture in that leg. It is slightly bowed. It's not quite as bow-legged as the infant that we looked at. And you can see the fracture right where the arrow is pointing. So that's due to osteomalacia. Not commonly seen anymore because luckily we have fortified foods in our country. Okay, now, I shouldn't say it's not seen in our country because we have fortified foods. Osteoporosis. Okay, this is a great picture. So once again, I'm going to keep it zeroed in on these PowerPoints here. You could see normal bone on the left. You can see the osteoporotic bone on the right. So we don't have a limitation of calcium salts with osteoporotic bone. What we have is we don't have enough bone. You can see it's a much more spotty presentation. The bones become porous and lighter. Spine and hip are very susceptible, especially in women, especially after menopause, because estrogen helps to deposit bone tissue. Okay, so that lack of estrogen tends to lead us to have thinner bones. And of course, lack of calcium and vitamin D. Exercise is going to be important. I'm going to zoom back out here. Okay, exercise is going to be important too. Remember back, I just taught you about Wolff's Law. Okay, Wolff's Law is when our bones are stressed, an electrical current is put on our bones, which draws calcium into the bone. Wolff's Law tells us that when we put stress on the bones, such as weight-bearing exercise, we will draw more calcium into the bone because by putting pressure on them, we have an electrical current which will draw calcium into the bone. Okay, so very important. Also not smoking. Okay, smoking will deplete your bones as well. Okay, so osteoporosis, some good ways to prevent that. Okay, that next slide is a presentation or a picture of normal versus osteoporotic bone. Okay, osteoporosis treatment and prevention. Take calcium, take vitamin D, take magnesium. Okay, 3 very, very important fluoride supplements for children. Increase weight-bearing exercise. Walk 30 to 60 minutes a day. Start lifting some weights. Doesn't have to be anything crazy. Okay, just light weights and just do repetitions with the arms. Hormone replacement. Those are, yeah, that gets into some iffy stuff because with estrogen, they're seeing some links with breast cancer. But there's some drugs that you could take. You take Fosamax, you could take selective estrogen receptor modulators, which are more apt to avoid breast tissue and go into other tissues and cause estrogen-like effects, which would help to increase our bone density. Okay, so there are some options there. Fosamax, some people are on the fence about that. I believe with the highest rates of Fosamax, the best bone deposition would be 7% if you're taking enough calcium along with it. So some people don't like the side effects for that little bit of benefit that they get. I'm not saying that it's negative, I'm just saying it's something that you want to research if you're interested in it. Okay, developmental aspects of the bones. Okay, if you remember back to embryology, we've talked about the 3 germ layers. Okay, we've got mesoderm, we've got endoderm, and we've got ectoderm. Okay, ectoderm, once again, so these are all 3 layers that we'll find in the embryo that will eventually develop into all the tissues of the body. Okay, mesoderm is the layer from which we will get skeleton and muscle. Okay, that little bone starts to develop at week 8. It's just amazing. Okay, week 8. And it all is ossified except for the epiphyseal growth plates at birth. Okay, so those are still open, ready for the body to start growing. Okay, epiphyseal growth plates, once again, persist until 18 or 21 years of age. Bones start to decrease in size in our 40s. I'm almost there. Okay, they start to decrease in size. So it's really important once you hit 40 to start doing the weight-bearing exercise. Start to deposit more bone. Try to fight that bone loss. Okay, this is a great picture. This is a picture of an embryo. Okay, I'm going to zoom in on it. And what's great about this is you could see all of those different growth centers starting to ossify. They start to grow towards each other until you form that complete bony skeleton. I think that's a fascinating picture. Okay. Nearly all bones are completely ossified by age 25. We already talked about that, bone mass decreasing by the 4th decade. Rate of loss is determined by genetics, environmental factors. I would also say whether you're male or female. Okay, females are much more prone to losing bone mass as they get older. Okay, so I would also add in there male versus female. Okay, in old age, bone resorption predominates and the bones tend to get thicker and weaker. Okay, so once again, it's real important to take your calcium, D, magnesium supplements, and do weight-bearing exercises as well. Okay, that's the end of the bone tissue lecture. If you have any questions whatsoever, please feel free to send me an email or see me in lab or see me in my office hours. I'd be happy to help you. Thank you guys so much. We'll be talking about bones next week.